Hello, my name's Charlene Douglas and I'm a relationship therapist working with individuals and couples. I work with people to help them to understand how to acknowledge what they might be feeling, particularly when they've gone through a period of change in their lives, but also to be able to find the words to express that to their partner. For the past few months, I've been working with Fitterworth and the Connections Relationship Programme to design resources and a toolkit to help to facilitate that kind of conversation. My role is to encourage couples to create a space where they feel really comfortable speaking with one another and developing a more intimate relationship. This video accompanies a toolkit that I've designed to help you to understand what you might be feeling as you go through your stoma journey, but also to help you to find the words to speak to your partner about it. For your ease, this video is divided into chapters. That means you can watch it in full, or you can head to the section that's the most useful for you. You can also watch it alone if that's helpful for you, or with a partner. It then gives your partner the space to ask questions and for the two of you to have a discussion. This video is an opportunity for you to hear from a couple who are further along in their stoma journey. I'm going to be talking to Rachel and her husband Stuart about their relationship challenges and breakthroughs since Rachel's surgery. For many years now, I've been working with couples who've experienced a significant change in their relationship. Illness and surgery can really create a different dynamic for couples, and it can be really difficult to find the words to really connect. So let's hear from Rachel and Stuart to hear a little bit more about what was worrying them around the time of Rachel's stoma surgery.
Well, back in 2016, I had a diagnosis of bowel cancer. I woke up with just a range of mixed emotions. First thing was I was just really relieved that the surgery had gone well and all the cancer had been removed. And then even though I'd had information beforehand about what it meant to have a stoma, I was really just terrified of kind of what was happening to my body and how I would manage the stoma.
At first I felt it was a challenge, or it could be a challenge, firstly on a practical level. How do we deal with it? What did that actually mean? I didn't even know what a stoma was. I'd heard about them, but I thought that only happened to older people. So that was the first practical thoughts I had. And then they moved into, I guess, more emotional feelings around what would that mean? How would I get close to Rach? Would she feel difficult? Would she feel challenged by me being close to her?
My husband, Stu, he's very understanding, and he was an absolute dream to kind of have by my side as support. Even so, it's just a very scary thing to talk about between you. Maybe you don't talk about it to start with because you don't know quite what it's going to be like. My
first and overarching feeling was that of fear. Fear of the unknown, and a fear that we would get things wrong. I also had an overwhelming sense of that I wanted to protect Rach, a feeling of protection, that I wanted to be there for her and I wanted to take it away from her. I guess I didn't get the support I needed at the time because I didn't know where to go. I didn't know who to call. I didn't know what to research. And when you're researching on the internet, you would find things that were applicable to the patient, not the patient's partner.
So I just didn't know how it was going to affect our relationship, how it would make Stu feel, and how I would actually feel about this new body that I would need to cope with.
Hi Rachel, lovely
Hi,
to
Charlene.
meet with you and to have a bit more of a deeper chat about your stoma experience. So can you tell me a little bit about what that journey was like for you when you sort of first had your stoma?
Well, yeah, it's just something quite terrifying and really is something quite alien almost to accept that you've had something, I found, something done to my body. I'd not had surgery at all before and was really fit and well and everything before this all happened. So with the help of the nurses, and just once you get home, it's just trying to accept sort of what's happened, which is was quite a shock to me. But then being able to manage the stoma, the better you can manage it, then the easier it is to get back to more of a normal life.
You spoke there about the shock initially. I suppose that takes some getting used to, doesn't it? Having the stoma and then what that means for you as a person, but also your relationship.
Yeah, definitely. Talking about that with Stu is just something which came quite naturally to us, but was still a bit difficult in certain areas. You know, I was so blessed with having Stu being so supportive that I probably would say that I overshared some things about what was happening to my body and the things that I felt, the sort of support that I needed, or the maybe the new products that I needed to suit me. And then with other things, I think I probably avoided talking about how I felt about my body image and myself. You know, you've got something right in front, you can't hide it. You can hide it, but first of all, you think everyone is looking at you, they can notice your stoma bag, and that's actually not true at all. But that's how I felt, and I think that's how many stoma patients feel. Even though if your partner says, "Oh, you're still as lovely as you were," and all that type of thing, it's hard to believe that when your body's changed and you're not particularly accepting of it. So that just takes a bit of time and love and all the rest of it to just make you. It just over time that has got better.
I wonder what it was like also from a physical intimacy point of view. Was that also quite difficult to develop again with your partner?
Yeah, very difficult. And I think as time goes on, you just learn to sort of, I think, you know, your partner sort of might say, well, I touch you differently or not there because it might hurt, but then you just get that sort of understanding between you. But the emotional intimacy side of things as well, you know, it might be that you are not sort of physically ready to accept the things that have happened to your body, but if it's just a touch or a kiss or something like that, can just make you feel that everything's going to be all right.
And what was it like to have those conversations, those open conversations about your emotions with Stu? How did you find that?
Well, I think that took quite a bit of time, really. And I think that you beat yourself up a bit thinking, oh, we should have spoken about this by now, and then, you know, time goes on and perhaps you haven't spoken about things. So it's quite a challenge, really.
And in terms of communication within the relationship, has the communication improved?
In parts, yes, but again, I can't say that, you know, we've waved a magic wand and everything's perfect. There's some things which I still don't feel very comfortable about, but I think it's just trying to find the right moments to bring up that particular subject, and not kind of look for immediate solutions as well. They do sort of happen over time, I think, as you get more used to things.
Do you feel like if there's anything that maybe you didn't know before that you kind of wish you did know to have helped you on this journey, what would that have been?
Definitely don't give up on finding the right stoma products is one, and that's a bit more sort of not the emotional side, but that can, if you can manage your stoma better, it's made 100% difference to how I felt about myself and you know, our relationship. And then there are other things like for females, you can get sort of like a lacy kind of band, you know, different things like that, which can, if it's more of a about being a bit more open in intimacy, then you can make yourself feel better, choose the right moments. And I think try not to put yourself under too much pressure to think everything should be all right by now. So that really, it's easy to say, but just try to be a bit kind to yourself on that front.
Yeah, it sounds like really good advice that you should maybe just take every day as it comes and really listen to your body, listen to what your body needs, and listen to what you need emotionally as well.
Yeah.
Well, thank you. It's been really lovely speaking with you today, and I really wish you the best on the rest of your journey.
You too, Charlene. Thank you.
Thank you. Hi, Stu.
Hi, Charlene.
So nice to meet you.
You too.
So I've spoken to Rachel about her journey. So I'd be really keen to hear your story. What was that journey like for you when you first heard that Rachel had a stoma?
It was one of those kind of voyages of discovery. Rachel's diagnosis led to the stoma. So we dealt with complex issues, first of all, with the cancer diagnosis. And then the stoma was almost a celebration of that. It meant that the cancer was gone. So in one way we could look forward, but that then brought on new challenges. I wanted to make sure that Rach could cope with a stoma. That was a big feeling for me. I wanted to make sure that I offered support for Rach during that time, although I was also thinking, crikey, what do we do? I've got my own fears around it. Would I be able to get close to Rach again? Would she want me to? Would I be able to have physical contact with her? Would it be painful? Would there be things that she would feel uncomfortable about, especially if the stoma was full and the bag was full? How would we deal with that moment? Would it lead to awkwardness? And I think then there was a fear that we might pull apart from each other.
And in terms of communicating with each other, was that quite an easy process for the two of you?
It was, because what we had was a name for the stoma. So it is known as Maganda, which translates to beautiful in Filipino. It was actually a nurse at Worthing Hospital that named it for us. So we use Maganda as that middle kind of person, that middle ground, which makes conversations a lot easier. We got used to having Maganda with us, and I learnt to just go, is that too quick? Are we too soon? How do you want me to hold you? Is there a better way to hold you if you're not comfortable or uncomfortable? Trial and error, I guess, through a lot of it, but and some laughs. Actually, suddenly you realise you're pressing on something and it might make a noise or it may do something, and then, we could blame Maganda. But there are times where we don't talk about it at all as well. And that is, I think that's a good thing. I think that's when you become more familiar with it and it becomes more natural. I think if you're always talking about it, there may be a problem there. That's probably our view. But I guess now we're learning to live with Maganda. She comes up less often in the conversation. So I think we're probably getting there. But it is a journey. It's not something that you can expect to happen really quickly.
What I've heard you say a few times there is the importance of protecting her and making sure she's safe, which I suppose is well, I don't suppose it is such a beautiful thing, and it shows the love you have for one another. But is there space then for you to really think about and process your own emotions around this?
It's difficult. There isn't anyone that I can talk to necessarily about it because it is very personal to Rach, and that becomes very personal to me. So I don't have a peer group that I would feel comfortable discussing it with. And I've not found an online forum or anything that supports partners. It can be lonely because, there is something there that could potentially pull you apart. And I think, you just have to keep checking in with each other.
What sort of advice would you give someone who's starting on a stoma journey? I suppose from the person who has the stoma, but also a partner as well.
I think realise that there will be, right at the start, obviously it's a challenging operation to undertake anyway, so there's a lot of time needed to repair, to just be comfortable. So as a partner, don't rush. I just learnt to live at Rachel's pace, and that was absolutely fine by me. It was more important to see her recover, become well, being able to deal with it. It's a big thing, changing a stoma bag for the first and second time when you do it on your own. So knowing that I was close to her while she was doing that, it's strange actually, Charlene, in some ways you can feel disconnected, but in some ways you can feel even more connected because it's such a personal journey. There's only two of you that can take that. And I think that, if anything, it's brought us together even more.
That's really lovely to hear. It's been so lovely speaking with you today, Stu, and I really wish both yourself and Rachel the very best on this journey.
Thanks, Charlie. Thank you.
So Rachel and Stu, it's lovely to have the two of you here together. And I'd be really interested to hear a little bit more about your journey as a couple. And I understand that there are 3 people in this relationship. There's yourself, Rachel. Yourself, there's Stu.
There is.
And I hear there's a Maganda.
Maganda is my stoma. After my surgery, the wonderful nurses that were looking after me, one day all stood around my bed and needed to check the stoma. And one nurse said, "Oh, Maganda." And I believe that's in the Philippines means beautiful. So that just stuck.
Perfect name, right?
Yeah.
So Maganda it is. So can you talk a little bit about some of the positive elements of having a stoma? Because we have spoken about some of the challenges, the ups and downs, but I'm really curious about how it's brought you together and some of the positive elements.
Well, I think because we've shared this journey together, even though it's not just been me, it's been happening to me, sorry, it has brought us closer rather than not talking at all. So, I've been so blessed with Stu, they're supporting me, that I've felt that I can talk to him about different aspects of what's happened over the years. And we do have some sort of funny stories as well. So it's just stuff that we've, experienced along the way together.
Do either one of you have any sort of examples of some funny stories?
I think most of it is connected to noise, isn't it?
Yeah.
I think is probably one of the things, and it always happens at a time where it goes quiet, and then all of a sudden Maganda will start to sing. And she's got a good voice, but it can be a little bit unsettling. And of course, in certain situations, it can be very difficult for Rach to have something that she's got no control over, but we're totally comfortable with it. And I think that's a big thing, is kind of saying to other people as well that there's nothing Rach can do about this.
Where I have felt particularly embarrassed in certain situations, or if we're in with friends or family, Stu just sort of helps me to realise that, this is part of you now. And even though sometimes I don't completely accept it, it does help me to deal with the situation a bit better.
Yeah, I think it's about helping us to educate as well others that there is something here, and using humour to help their education process, so we can talk more openly to our family and friends. For maybe 14 or 15 months, we didn't really talk to our family about Maganda. It was something that wasn't really spoken about. They would ask me about Rach, and they wouldn't ask Rach about Rach. They had also been through a journey, and we mustn't forget that as well. They were part of the journey and probably felt even more helpless than we could feel, because they were one step removed. And so that was probably challenging for them. But I suppose I became the bridge in some ways to allow that communication. I think it was important to keep telling you that I had had those conversations with family as well. Hopefully that built confidence for you to make sure that you could then, feel more comfortable about talking about it.
So effective, clear communication in any relationship is really important. How would you describe the communication between the two of you?
Having this happen to me is, made us communicate more as such, because we either had to go one way or the other perhaps with it. So if I was worried about a certain situation, if you feel that you can bring it up with your partner, then do, because nothing is usually as bad as you think. And on the other hand, perhaps don't feel pressured to do so either, because that can then make it worse, where you think, I must talk about this, and you feel you can't then. So just try and let it happen,
I think it's also really important to say here that we know that not everyone is in a position where they have a partner, and not everyone's in a position where they have a supportive partner as well. But what it sounds like to me, though, is having someone in your life who can help you and support you through this journey can make the journey easier.
Most definitely, yeah. So if it's a friend or whoever you feel that may help you, I did hear, oh, you will live a normal life, but at the time and maybe many months afterwards you think that's not possible. But I have found that I have been able to get back to doing things that I really like and doing new things as well. So it is with just some support from anyone who you feel you could, trust and is there for you, that is so important.
Thank you so much for the two of you for sharing this journey. And I'm sure it hasn't been easy to bring it all up again, but I think what has been really powerful to hear is just how far the two of you have come and how it's really brought you closer together as a couple. So thank you so much.
Thanks, Charlene.
Thanks, Charlene.
Rachel and Stu, we've covered quite a lot today, haven't we? We've spoken about the importance of effective, clear communication with our partners. We've spoken about the importance of being really open when you can, but also having that space to process your own emotions as well, which is also really important. We've looked at the power of humour as well. That you've got a special name for your stoma, and that has really helped you to work through this. And of course, there's lots of other support out there, with your stoma nurse being one of them, and online. And, where possible, it's really important to share that with each other, to keep each other informed of what's going on within the relationship.
I think it's hugely important, Charlene. I know when we were going through our journey together with Maganda, it was, we were seeking advice and support, and well, actually your stoma nurse was a real, breath of knowledge for yourself, and then for me as well, because Rachel would obviously report back the findings from the stoma nurse and what had happened in the nurse meeting, and that was really good, and it made me feel comfortable that Rach was being supported clinically.
I think sometimes there might be things that, I would bring up with the stoma nurse that perhaps I wasn't comfortable talking to Stu about or needed some advice on. So that's where the stoma nurses are absolutely brilliant. You can talk to them about anything, and you won't be judged, and you'll get the experience and advice coming back.
One thing that I'd really like to introduce to the two of you is some of the tools that we have created together with Fittleworth to help couples to talk more openly about how they're feeling and about their emotions. Now, we spoke a little bit earlier about the importance of not forgetting who you are as a couple, what brought you together in the first place, what you enjoy together, what makes you laugh together. So these conversation cards are being created to remind you of just that. So the idea is that you spend some time, maybe choose a nice Thursday evening or Friday evening for a date night, and that you just take some time to ask each other questions around, what do you enjoy about me? What was the first thing you ever saw? What was the first thing you saw when we first met? What makes you smile about me? Things like that remind you of the reason why you're together in the first place.
That sounds awesome. Yeah.
Excellent. There's another tool that I'd really like to introduce to you called the emotional wheel, which is what we've got just here. Now, sometimes when we're feeling a particular strong emotion, it can be really difficult to acknowledge what we're feeling and even why we're feeling that. And so this emotional wheel helps you to just reflect on what might be going on for you, but it gives you some prompts because there are lots and lots of words on there, and you can then choose sometimes about 3, 4, 5 might be good, just to acknowledge what's really going on for you. It also helps to generate the conversation with your partner as well, because that could be quite difficult to start that conversation, can't it?
In terms of the resources, I think they would have been so useful to us at the time, and they still may be now. Doesn't mean to say we have everything sorted. One thing that I would say to someone in our situation about the resources is don't be frightened to sort of have access to the resources and actually use them, because quite often, I might sort of think something was a good idea, but it could be quite difficult to bring up with Stu or with, if it's with your partner. I often sort of thought, I just want everything to return to normal. Why isn't it? And it can be quite hard to think that you may need something like this to help you. But I think it would have, helped us on our journey a lot quicker if we'd have had them available.
And at the same time that I'm thinking, I would like a conversation starter as well, you know.
Yeah.
And a resource card, the conversation card, would have been a good way that maybe I would have picked something up if we'd have had them at hand and used that to elicit the conversation. So, you know, it's about bringing, it would have been really good to have to bring us together, so we could understand that each of us needed to talk about something, and maybe we both wanted to talk about something at the right time, but we didn't know how to start that conversation. That's the difficult bit, isn't it? Is getting it over the line and getting it started. So the conversation cards would have been, I think, a really good resource that we could have just kept on the kitchen island and just suddenly popped one up and gone, you know, shall we have a conversation, you know, something I would like to talk about. Or again, use them in a more, you know, confidence inspiring way when we could have thought back to how life was before and remember, actually, we're no different. We've just got something extra.
What other programs have you used that you found to be really useful?
Well, I accessed Simple Steps, which before my operations I was quite active, and then it is really important for someone with a stoma to build back up their strength, and particularly in the area that you've had your stoma. So I just found it a really helpful program that I could do at home, and I could do when it suited me. And there's various, as it says, simple steps, but from pre-surgery to post-surgery to 6 or 3 months on. And it helped me to build up my sort of confidence and fitness levels. And that was just brilliant, really. And the other thing was the Ostoma's Kitchen, which there is so much advice from all different angles when you have stoma surgery, and depending on the type of stoma and the reason you have the stoma, it can be so confusing on what to eat, what not to eat, and the Ostoma's Kitchen has recipes as well, so it's just been really useful to make sure that you have the right nutrition there as well, because it can be very easy to just stick to a very plain diet because you're worried about what you should and shouldn't eat and the consequences when you've done so. So it's just really helpful.
Excellent. So I think the very powerful message is that you don't have to do this alone.
No.
Definitely not, no. And, you know, I think looking on the internet can be helpful, but also very confusing. So these resources seem to just make things a lot clearer.
Yeah, resources that have been curated, you know, for you for that particular need, I think is really important. There's lots of focus on the clinical side, less focus on the lifestyle and diet side, but that is hugely important in part of the recovery, and allows you to live a more normal life. And watching Rach go through those steps and undertake the Simple Steps program has been really, really good, and has helped you to get back on the bike and help you do other things that you didn't think were possible. It's very inspirational.
Lovely. We hope you have found a lot of encouragement from listening to Rachel and Stu's journey. For more information on the Connections Toolkit and the Fittleworth programs, please go to fittleworth.com. If you've been affected by any of the issues raised in this video, please get in touch with either your GP or stoma nurse, who will help you to access the resources and support that you need.